can you talk a little bit about how this therapy is given?
Absolutely. So generally, and certainly at our institution, we are administering this medication in the inpatient setting. We typically will admit patients to the hospital one day or the evening before they're scheduled to receive the treatment and keep them for minimum 24 hours after the first dose. And then they get a second dose a week later. The first dose is, I often refer to it in clinic as a baby dose. It's a test dose. We follow what we call step-up dosing. And so you introduce a small dose to make sure that the body doesn't overreact to it. And then a week later, you give the full dose. And the reason for this caution is because the administration of this therapy can trigger an immune response that ultimately is hopefully going to have a net positive effect on the patient's life and eradicate some or all of this tumor, but it can be overwhelming, literally, right? The immune system can get so ramped up that patients can develop fevers, they can develop very low blood pressure, they can struggle to breathe, they can even have unique neurologic syndromes where they become confused or maybe transiently lose the ability to speak. These things are scary to occur outside of a hospital, first and foremost, but they're also potentially life-threatening if not intervened upon in a timely manner. And so for now, we are administering these under only these strict circumstances. Now, there are efforts to try to move this into the outpatient setting because I think you can all imagine that this is restrictive in our ability to deploy this medication, right? Not every oncologist has a cancer hospital adjacent to their clinic where they can easily do this. And so we want this to be available to as many people as possible. And so there are tests underway to see whether, with the right precautions, perhaps a short-term monitoring in the outpatient setting with some strict precautions to tell patients to come to the emergency room at the first sign of fever, the first sign of anything abnormal, whether that proves as safe to try to make this more widely available. But I think in the short term, this inpatient administration is probably the right way to go outside of a clinical trial or other extraordinary circumstances.
So I'll be brave if you're brave. I'll be brave, but only if